Hello friend, myself Nidhi Sharma, Assistant Professor at GD Goenka University, and I have prepared video tutorial on diabetes and its management. This tutorial incorporates detailed insight on diabetes and the various strategies for its management. As you all know, diabetes is the most prevalent disorder and it is the economic burden for our society too. Hence, we should have awareness about this disorder and its consequences. In this tutorial, we will discuss about diabetes and its type, and later on we will discuss how we can prevent, cure, treat from this highly prevalent disorder. This video will also cover the novel drug for its treatment, which are under pipeline, and what future plan we had made for its treatment. First of all, I would like to make you understand that what actually diabetes is. Diabetes is a chronic or a metabolic disorder in which either the pancreas does not make enough insulin or the body can't respond normally to the insulin that is made. Its symptoms include extreme thirst, the need to pee more than the usual, and feeling tired often. Diabetes is not a disease, rather it's a disorder because it increases the risk of other disease and health problems such as heart disease, obesity, high blood pressure, and hence it becomes an economic burden for our society. Now we will discuss about its type. There are broadly 4 types of diabetes. First is type 1 diabetes, which is also known as insulin dependent diabetes mellitus. Type 2 diabetes, which is also known as non-insulin dependent diabetes mellitus. Pregnancy induced diabetes, which is also known as gestational diabetes, and pre-diabetes, which is also known as borderline diabetes. Currently, at least 1 out of 3 people will develop diabetes in their lifetime. Hence, it is regarded as a highly prevalent disease. Now, we will discuss each of its type one by one. First is the type 1 diabetes. In this type, body is not able to produce enough insulin and hence person is totally dependent on the exogenous sources of the insulin, and hence this type of diabetes is also known as insulin dependent diabetes mellitus. It occurs due to the autoimmune beta cell destruction, usually leading to the absolute insulin deficiency, and these beta cell destruction may be due to the viral infection or some genetic factor also, such as human leukocyte antigens alleles, and autoantibodies against islet antigens are often detected in the early stage of this disease, and only 5% of the people have this type of diabetes, and it is usually diagnosed in children and young adults. Now, we will discuss the signs and symptoms and risk factor of this type of diabetes. Its signs and symptoms include: first is weight loss, frequent urination, irritability, blurred vision, and fruity breath. If one is feeling these type of symptoms, so he or she can immediately contact her physician and diagnose for it. Its risk factor include hypoglycemia, hypertension, dyslipidemia, insulin resistance, and obesity. Second is the type 2 diabetes. In this type, the body produces insulin in required amount or even more also, but unable to use it properly. It is also known as adult onset or non-insulin dependent diabetes. It is the commonest form, and about 90 to 95% of the person is suffering from this type of diabetes. Obesity is the risk factor for type 2 diabetes, and hence lifestyle modification and physical exercise reduce the risk of this type of diabetes. Weight loss, excessive thirst, unceasing hunger, headache, and dry mouth are the symptoms of this type. Unhealthy eating, overweight, family history, and lack of exercises are the risk factor for the occurrence of type 2 diabetes. Next is the gestational diabetes. This is the type of diabetes which occur in the pregnancy and hence also known as pregnancy-induced diabetes mellitus. The figure present in this slide depicts how the high blood sugar level in the mother brings extra glucose to the baby that will cause baby to put on the extra weight, and this will eventually lead to the fetal deformities. Usually there is no characteristic symptom of this type, so all pregnant women tested for it. It can go away after the pregnancy. It has more chances to develop into the type 2 diabetes, so it is recommended to test blood glucose level after every 1 to 3 years of the pregnancy. Extreme tiredness, vomiting, blurred vision, increased thirst, increased urination, extreme hunger and irritability are the symptoms of the gestational diabetes. Increased maternal age, family history of gestational diabetes, multiple pregnancies, high blood pressure, obesity and polycystic ovarian syndrome are the risk factor for its occurrence. Last is the pre-diabetes, or we can say borderline diabetes. If a person is having pre-diabetes, or he or she will have precautionary measures so that he cannot develop into the diabetes. He or she keeps a check on weight loss, avoid sedentary lifestyle, eat high fiber diet, take healthy diet, quit smoking, do not eat junk food, drinks a lot of water, quit alcohol, split meals, do exercise daily. As exercise decreases the resistance of the cell to the action of the insulin, so it becomes easier for glucose to enter the cell from the bloodstream and improve the glycemic control even if there is no associated weight loss. Now we will discuss about blood glucose monitoring. The goal of the diabetes treatment is to safely keep blood glucose level in the normal range, and this can be done by monitoring blood glucose level using the glucometer. The normal range of fasting plasma glucose level is 70 to 99 mg per deciliter. HbA1c level should be less than 5.7% and oral glucose tolerance test is less than 140 mg per deciliter. Now we will discuss about the strategies for improving the type 1 diabetes. Novel insulins or biosimilar insulins are the alternative options or therapeutic option for improving type 1 diabetes. But the problem with these options are lifetime treatment, because they are responsible for the management of the disease rather than its cure. The potential novel target for its treatment are pancreas transplant and islet cells transplantation. With a successful pancreas transplant, we will no longer need insulin, but these transplants are not always successful, and the procedure poses serious risks, and these risks can be fatal, so used when there is difficulty in the managing diabetes via the available options. Islet cells transplantation is the another novel target. This provides new insulin producing cells from a donor pancreas. Let's come to the lifestyle modification which one should adopt for the management of the type 2 diabetes. He or she should follow healthy diet, increase physical activity, manage his or her weight, reduce stress, get adequate sleep, or manages depression. This slide presents the classification of the drug used in the treatment of type 2 diabetes mellitus. These drugs are broadly classified into two groups. Basically, first is the oral anti-hyperglycemic agent and another is the parenteral anti-hyperglycemic agents. Oral agents are further divided into two groups. One is the agent that release insulin and another is the agent that act via the miscellaneous mechanisms. The agent that release insulin are sulfonylurea, meglitinides, and the drug of sulfonylurea category are chlorpropamide, tolbutamide. The drug for meglitinide category are repaglinide, nitiglynide, while the agents that act via the miscellaneous mechanisms are biguanides, thiazolidinediones, alpha-glucosidase inhibitors, D2 agonists, DPP4 inhibitors and SGLT2 inhibitors. On the other hand, parenteral agents are further classified into insulin and GLP-1 analogues and amylin analogues. The mechanism of action of each and every hyperglycemic agent will be discussed in the upcoming video. Let me discuss the emerging drug targets for the treatment of type 2 diabetes. First is the dual activation of glucagon-like peptide 1, that is GLP-1, and glucose-dependent insulinotropic polypeptide receptor, that is GIP, agonist. Increase insulin sensitization via the glucocorticoid receptor antagonist. And third one is decreasing hepatic glucose production, glucagon receptor antagonist or inhibitor of glycogen phosphorylase and fructose 1,6-biphosphatase are used. The future advances for its treatment are regenerating human beta cells or brown fat transplant also may aids in the weight control and the management of the diabetes. In nutshell, we can conclude that diabetes is not a curable disease, but it can be managed by strictly adhering to the treatment and by the lifestyle modifications. Thanks for watching. If you like this video, then do like, share and subscribe our channel Soma's Evolution Classes, and for more interesting videos, keep watching our channel.